Some say it began with a small, bitter white pill, penicillin, whose near-miraculous curing properties delivered unprecedented hope to humankind. But this little miracle pill and the breakthroughs that followed also delivered unprecedented new situations, outcomes, and for some, unthinkable decisions. As early as the 1950s, philosophers, theologians, legal scholars, doctors, and others began to raise questions about the emerging consequences of advances in modern medicine. As time passed, those concerns multiplied as newfound miracles of biomedical technology became almost routine. And a question arose: who would address these concerns at the bedside where physicians and nurses, patients and families struggled to make good decisions? Who would ensure the preservation of human dignity? In 1984 in Kansas City, a noted philosopher, an aspiring attorney, and a young psychiatrist came together to transform a vision of practical bioethics into reality. And they never looked back. Today, the Center is a national leader in practical bioethics, committed to providing guidance at the crossroads of decision to communities, professionals, and families, and to raising and responding to today's most pressing issues in health, healthcare, and research in our own community and across the nation.
The real value of Cruzan and of the center is that it causes people to talk about their views, about their values, and gives them the permission to know it's not dark, sinister, macabre to talk about what we want at the end of life. It's going to come to us all. And if we do have that talk at a time when people we care about are relatively healthy, it really is a gift to those people.
There are some weighty things that we deal with, ethical issues. And each one is weighed individually.
We did a wonderful guidelines document on the care of patients with HIV. Now this is the time when HIV is the big stigma. And we had practices, I regret to say, in our healthcare institutions where we might have a purple dot on the patient's chart if the patient has HIV. Such discriminatory practices. It took us about 1.5 years to develop guidelines about how ethically to care for patients with HIV. And of course, that kind of discussion all over the US of A led to universal precautions. So you treat everyone, which is non-discriminatory, which is a manifestation of justice.
The Center engages families, professionals, and policymakers in a dialogue to gain understanding and find common ground on complex ethical issues using the tools of bioethics. Individuals and organizations want to be confident in the integrity of their actions. The Center provides a forum for objective, expert, and trustworthy counsel at the crossroads of decision. This approach allows for development of reasoned, real-world responses and, ultimately, the greatest peace of mind possible. Through this process, the Center has put practical bioethics into action within the community and across the country, making a tangible, positive impact on issues, legislation, and lives.
The basic work that the Midwest Bioethics Center is doing in developing public trust in the integrity of this human subject research plays an important role in the overall goal of Kansas City's ambitions to become a major center for biomedical research.
A community-based organization that really works hard to bring people together in community to work on these issues can impact policymakers at the very highest levels.
If you can imagine 26 different states that have been guided by center staff to improve end-of-life care. That came out of this little bitty group in Kansas City that spent 3 years trying to improve end-of-life care in our midst, and then knowing how we did it, and then getting Robert Wood Johnson to fund it, and we could take it from all the way from Hawaii to New York.
Today, the center is working in 4 core areas: aging and end-of-life care, clinical and organizational ethics, disparities in health and healthcare, and life sciences and research ethics. These 4 domains form a solid platform for addressing the complex challenges of tomorrow.
The center has been and will be at the forefront of helping the rest of us sort through these extremely profound and difficult questions.
The timeliness of an investment in biomedicine is optimum. And for the Midwest Bioethics Center to recognize that opportunity and to perceive the importance of building public trust in human subject research is an essential element of getting the discoveries that will come in the post-genome era of biomedical research into public benefit.
I jokingly say bioethics is a growth industry. I think that many of the issues that we'll face in the future we can't even imagine now. I think as we look at the implications of the mapping of the human genome, and there are many other things that I could point to, we've really only seen the tip of the iceberg. And it's not always the technological, the scientific. I mean, even the aging of the baby boomers is going to be a test of this society that few of us can imagine.
For 20 years, the center has built a strong foundation for the future. It will continue its work, empowering healthcare professionals, patients, and families, gathering people of diverse views whose discussions will inform health policy, facilitating and establishing regional and national coalitions, and above all, using ethics as a practical tool to preserve respect for human dignity.
For centuries to come, people will look back on the early 21st century as one of those pivotal moments in human history.
How we live and how we die, and how we use medical technology, and if we cannot speak, who decides. And that debate has really just begun.
We have more than 45 million people in this country without access to care. So we have become a nation of haves and have-nots.
People and the struggles, and medical struggles, health struggles.
What ought we to do about it? And that's what ethics is about.
When I think of the center, what comes to mind? I think of the power of a small group of dedicated people to make change.